Hi, Dr. Tom again from Smiles by the Sea. So perhaps you saw my last video on brushing and thought, he didn't mention anything about flossing. Maybe I don't have to do it. Well, unfortunately that's not the case, but the good news is you only have to do it once a day. So I think the reason that many people give up on flossing is because it's too difficult, sometimes it hurts or it's uncomfortable, it takes too long. So we've heard every excuse under the sun, but let me show you a technique that'll make it a little bit easier. So what you want to do is start with standard waxed floss. Wax is going to be easier than unwaxed, especially if you're new to it. I like Gum, Butler, Johnson & Johnson, Listerine, Glide. They make good flosses to start out with. You're going to take about 18 to 24 inches. You don't have to measure, just kind of estimate. And you're going to start wrapping it around the middle knuckle of your middle finger. If you just jump into it from here and you don't get set up, you'll find that it's going to take longer and it's going to lead to one of those three things I mentioned before. So you want to wrap around the middle finger until you have about 6 inches left, and then you're going to start wrapping around the middle knuckle of the middle finger on the other hand. If you wrap around the tip of your finger, what's going to happen is you're going to cut off the circulation. So you'll see how this is important. When I have it wrapped, I can hold the floss with just my middle fingers like this, and then I can control it with my two pointer fingers. This is going to be really critical when I'm going to get to the back of my mouth, like that. If I have to get 4 fingers in the back, especially if you have big hands, it's not going to work and you're going to give up. So let's go to the model and I'll show you the technique. So when I observe a lot of people floss, what I notice is that they'll tend to just go quick up and down, and they hit a few teeth, and then they're done. They throw the floss in the garbage, and they feel like they did their job. Unfortunately, a lot of the plaque exists in between the teeth where the toothbrush doesn't reach, and we have to create a specific shape with this floss in order to get it out. So first of all, what plaque is, it's that sticky substance you feel in your mouth in the morning that's produced by bacteria to help trap sugar. So we want to get in those back corners, and when we get through the contact, we want to create a C shape this way and go side to side, and a C shape this way and go side to side. In each contact, we're making a C this way and a C that way, and we're going side to side all the time. We want to avoid a lot of hard up and downs. That's when you can tend to create like that slingshot effect if you have a tight contact and then you start to bleed. And what's going to happen is once you start bleeding and it hurts, you're going to give up and you're going to be done with it. So if you encounter a tight contact, again, remember side to side like a violin bow, and eventually it'll slide down. I'm going to make a C here and a C here. I tend to start in the back of the mouth and I'll move either from right to left or left to right so that I don't miss anything, because what happens is if you start in the middle and you go a little bit to each side, you don't know where you start and where you ended. When you get to the back of the mouth, again, you're going to use your fingers like this, and you're going to shimmy down the back side of the backmost tooth, because this is an area that the toothbrush has a hard time getting to. And the final thing that I want to share was that the reason we wrapped the floss more around one finger than the other is so that as needed, or every 2 or 3 teeth approximately, we're going to roll the floss onto the finger that has less and off of the finger that has more to expose a clean piece, so that we always have a clean piece when we need it and we're not just spreading plaque from one tooth to the other. So now that we've covered the technique on proper flossing, let's address some of the most common questions that we hear from our patients.
When is the best time to floss? Is it before I brush my teeth? Is it after? And is it better to do it in the morning or in the evening?
So that's an excellent question. People ask this all the time. It's more important how you do it than when. So the fact that you do it once a day is critical. I prefer that you do it at nighttime. It should be after you brush your teeth. That's how I do it. But if you did it before, some people make the argument that it loosens plaque up before you brush. The main thing, if you brush and floss, all the plaque should be gone.
What about those floss picks I see?
So a lot of people like to use a floss pick because they struggle with using a regular string floss. A floss pick is something like this. It looks like a bow and arrow. Usually it's plastic and it's got a little string here. You could do pretty much the same job as regular floss. The only downside is, remember how I showed you how we use a clean piece of floss every few teeth? With this, you're using that same 1 inch of floss on your whole mouth, all 32 contacts. So you really have to, if you're going to use something like this, you really have to clean it in between every tooth or two so that you're not just spreading plaque from one tooth to the next or spreading food from one tooth to the next. The other thing with floss picks, I find that because it's wound very tight, you have a tendency to have that slingshot effect and cause bleeding in your gum if you're not really careful. So again, on those tight contacts, you just want to saw side to side like a violin bow and just let it go down through the contact like that. Now, in lieu of floss picks, something that we often recommend for people that have dexterity issues with traditional floss might be an interproximal cleaner. They come in all shapes and sizes, so this shows you a large one and a small one. So you can find these ones that are reusable. You can use them several times until they look worn. Above those, I like something from gum called soft picks. These we give out frequently at the office, and these are my favorite. Essentially what you would do is you would break one of these off. They're one-time use. You can go around your whole mouth with this one. And what I'll do is show you a little bit of the detail here. It looks like a little Christmas tree with little bristles, so that as you work it in between the teeth, it's going to get in between, and those bristles will capture any food and plaque and come out with it. Again, like the floss pick, you're going to want to wash it in between, and then when you're done, you just throw it in the garbage. These are great because you can keep them in your car, in your wallet, purse, and they're great for traveling and just after lunch, things like that. So basically, some great questions on flossing. I want you all to get out there and give it a try tonight. Maybe watch the video one more time to give yourself a little refresher, and I promise we'll notice at your next checkup.